Good afternoon and welcome to the Governor's Interagency Advisory Council on Homelessness to Housing. This meeting has been publicly noticed in compliance with Nevada's open meeting law. Chair Tim Robb will call the meeting to order.
Good afternoon, everyone. It is 1:02 in the afternoon on March 19th, 2026. I'd like to call this meeting of the Nevada Interagency Advisory Council on Homelessness to Housing to order. Will the moderator please call them?
Yes. Chair Tim Robb,
I'm here.
Senator Dina Neal, Assemblymember Max Carter, Administrator Robert Thompson,
Here.
Administrator Stephen Acroft,
Here.
Deputy Director Emily Testweed,
Here.
Colonel Mary Devine,
Here.
Judge Bridget Robb, Judge Mike Montero,
Good afternoon. I'm here.
Sheriff Jerry Allen,
Present.
Lieutenant Shatana Daniel, Dr. Annie Wilson,
I am here. Thank you.
Dr. Katrina Grigsby Thedford.
Present.
Thank you, Mr. Chair. We have quorum.
Fantastic. Thank you all for being here this afternoon. Appreciate you guys jumping on so we can meet quorum. So with that, we can move on to agenda item number 2, which is public comment. No action may be taken upon a matter raised under this agenda item until it has been specifically added to in a future agenda. Comments may be limited to 3 minutes, and I will also be keeping track of time today because I do believe we have a couple folks that may be wishing to make public comment. If you're making public comment via phone, can you please call in from 1-775-321-6111. Meeting ID is 974-857-615, followed by pound. We're now open for public comment. Is there anybody on Teams that wishes to make public comment? Abigail, has anybody written into public comment?
There is none.
Okay. Give it just a minute to let those that may be dialing in on the phone catch up. Second call for anybody on Teams wishing to make public comment. I haven't seen anybody call in either, so I think with that, we're good to close for agenda item number 2, public comment. We will move into agenda item number 3. This is for discussion and possible approval of meeting minutes from the October 29, 2025 meeting of our group. Is there any discussion on the meeting minutes from the October 29th meeting? I'd entertain a motion for approval of the minutes.
Does Steve Acroft move approval?
Mary Devine, I second.
Thank you both. We will go to a vote. All those in favor of approving the minutes from October 29th, say aye.
Aye. Aye. Aye.
Aye.
Any opposed? Okay, meeting minutes from October 29th are approved. Agenda item number 4, discussion and possible approval of the meeting minutes from December 5th, 2025 of our Interagency Advisory Council on Homelessness to Housing. Do we have any discussion on those meeting minutes? I'd entertain a motion for approval of the meeting minutes from December 5th.
Steve Acroft move approval.
Thank you. Do we have a second?
Mary Devine, I second.
Thank you. All those in favor say aye.
Aye.
Aye. Aye.
Aye.
Any opposed? Meeting minutes from December 5th are approved. Now we will move into agenda item number 5. Discussion and possible action regarding the review of the housing applications for the Nevada Housing Division. Administrator Acroft.
Thank you, Chair Rob. Actually, I am going to pass the baton to Tracy Charbonneau from the division, who I thought I saw her on the call earlier. Tracy, if you want to go ahead and proceed.
Sure. Thanks, Steve. This is Tracy Charbonneau, Grants and Projects Analyst with the Nevada Housing Division. I'm excited to report that last month we opened our pre-application for the Supportive Housing Development Account funding in combination with our homeless prevention application. We have $1.5 million available for rental assistance contracts for supportive housing and $1 million available in supportive services funding. We've also performed some targeted outreach to rural community partners to encourage application submissions, and these applications will close on March 26th. In May of this year, 2026, we'll be opening up our development combined application process, and we'll have another round of available supportive housing development account funding for those units that are currently in development now, and will begin their lease up process within 12 months of the award. Thank you.
Fantastic, Tracy. Thank you so much for the update, and thanks for the hard work that's gone into moving all of these initiatives forward. Is there any discussion by members of the council that they wish to have with the Housing Division? Any questions from anybody? Okay, hearing and seeing none. Thank you so much for everything you do, Tracy and team. Please pass it along to the other folks at the Housing Division. You guys do amazing work and appreciate everything you do. With that, we will move into agenda item number 6, discussion and possible vote to adopt the strategic plan from our team on the technical advisory team. Do we have somebody from that team wishing to make any remarks on that agenda item? See Brooke maybe on here.
Hi, good afternoon, Chair
afternoon.
Rob and members of the council. Brooke Page for the record, Vice Chair for the Technical Assistance Committee. On behalf of the committee, we just want to thank you all for the opportunity to uplift the work that's happened at the Technical Assistance Committee. We've developed an action plan and adopted at our last meeting the action plan. We've also put forward some recommendations on priority action items that we would like for the council to consider. There's 3 of them outlined in a memo that you all should have received related to housing, one related to homelessness prevention and intervention, as well as wraparound services. We also made a recommendation considering the update to the strategic plan is scheduled to be updated by 2027. And we have made a recommendation for some targeted outreach to state agencies in 2026 in order to help inform the update to the strategic plan in 2027. That's at the end of the memo for you all to consider. And lastly, the technical assistance work group is eager to support you all in this work, and we've made also some additional recommendations related to ways in which the technical assistance committee can support you all. And so there's some recommendations there that we've put forward of just some targeted ways that we could support translating high-level strategic goals into step-by-step implementation ideas, providing subject matter expertise related to funding alignment, and recommending maybe future agenda items that you all can consider for your meetings moving forward that could help inform the strategic and then leveraging feedback and being a feedback loop to the community, our local continuums of care, and the ways in which we help operationalize the strategic plan. So that memo is pretty robust. I will stay on if you all have any questions about these recommendations or have any thoughts, but we're hoping to get some direction from you all today.
Thank you so much, Brooke. Really appreciate all the hard work as always. I know you guys work diligently to make sure you bring as robust of recommendations, and path forward and all of the things to us. So with that, I want to open it up to members of the council. Does anybody have any discussion, questions, hopes, dreams, ideas for this agenda item?
So this is Dr. Katrina for the record. So we received the memo via email, correct? Do we have access to that now so that anyone can review it to make sure that they don't have any questions or concerns? I don't remember exactly. I'm sorry.
Sorry, Dr. Katrina. Brooke, for the record, I could also share it here. I have it available if you would like me to share it for you all.
Yeah, because often my items get lost, like I review it and it's like, oh, I wanted to pull it up now to see if I took any notes on it. And my brain is kind of all over the place. So that would be so helpful if it's allowable for Brooke to share that. Chair Rob? Yeah.
Absolutely.
Thank you.
Okay.
Good.
Thank you.
I think
Okay, can you all see that?
Yeah.
Okay,
you want to give us a broad,
overview?
yeah, you want to kind of just walk us through it and just move it a little slowly so we can glance at it, Brooke?
Okay,
Is that
great.
okay?
Yeah. Okay. So the memo is dated February 27th. We had a group of TA work group members that helped inform this, and the vote by the technical assistance work group at our last meeting this week actually approved this memo to you all. So it just starts off with the purpose. And the purpose of this memo is, one, we would like the work that's been completed to operationalize the strategic plan and homelessness. We'd like for you all to consider that with the action plan. We've adopted that plan at the technical assistance level. It's now hopefully elevated to you all for you all to review and help us to start to implement the action plan. There's also 3 priorities that we've outlined in this memo that we'd like for you all to focus on, and helping us advance these 3 priorities related to the action plan. And then we've provided recommendations regarding the role that we'd like for you all to consider for the technical assistance work group to help support you in your work. We've made some recommendations there. And then lastly, we've provided recommendations related to updating the next strategic plan that's due according to statute. It's supposed to be updated every 5 years. That 5 years is up in 2027. So we've made some recommendations of how we can get that updated with some state-specific action items that the state's doing to address homelessness. So here is a summary of work completed to date. The technical assistance work group, we've assigned each strategic issue within the strategic plan to different champions within our technical assistance work group. And each of those champions convened a smaller group of community members, TA work group members, and each of those issues related to housing, wraparound supports. There's 8 different strategic issues in the strategic plan. We literally broke those out, convened work groups, and developed the action plan that you all should have access to. It's a Excel workbook. Each of those tabs of the action plan is related to the strategic issue. And you can see there's various different actionable steps that we are recommending you all to consider in that action plan. So that was a long, probably a 1.5 year long exercise to get that action plan developed. We've also identified substantive action items aligned with the strategic plan. We've conducted outreach through surveys, distributed to the 3 continuums of care in Nevada, providers, people lived experience. We've presented at various different statewide conferences, the conference in homelessness, as well as the housing conference to the strategic plan. We are reviewing and synthesizing input from different community partners and TA members have all informed this action plan. So we believe we've done a lot of due diligence to ensure that the action plan encompasses as much of a statewide voice as possible, that we can have bandwidth and capacity to kind of ensure that it's informed. This process surfaced consistent themes across geographies And there's 3 priorities that bubble to the top that we'd like for you all to consider. And those 3 strategic issues are actually outlined here. Housing was one of those areas that came to the top. It was the number 1 surveyed issue is a lack of housing to address homelessness. And so there's a recommendation that as a state, we need to identify permanent funding sources in order to ensure that we've got the housing stock to address homelessness. And so we've got some recommendations here of how we would like for the council to help us inform this particular action item. The TA work group recommends that the council exercises the leadership at this table to explore, help advance permanent sustainable funding sources to support housing investments across Nevada. Stakeholders consistently identified long-term funding stability as a prerequisite to scaling housing solutions. So in your action plan, under the housing tab, there's probably about 8 different action items that we are suggesting as far as steps that can help us advance this particular strategic issue. And so we'd like for you all to consider those action steps and help us figure out how to advance housing and address housing. The second priority was homelessness prevention and intervention. The recommendation is to target prevention funds more accurately for diversion and problem solving to help prevent folks from ever entering the homeless response system. We feel like if we can go upstream, help stabilize folks and prevent homelessness, it will also support the ecosystem. The TA work group recommends that the Interagency Council support statewide efforts to improve how homelessness prevention resources are targeted and deployed. Specifically, the council could promote alignment around diversion and problem-solving approaches, refine eligibility parameters, and encourage flexibility in prevention funding to ensure resources reach households most at risk of entering homelessness. And then the last one that we'd like for you all to prioritize is the services, the wraparound services, to engage stakeholders to establish partnerships and leverage existing resources to help provide wraparound support services for people experiencing homelessness. And so this is done by facilitating partnerships across systems, including the healthcare, behavioral health, workforce development, education, and reentry services, leveraging those various different cross-sector partners to help underscore the importance of coordinated wraparound services to support housing stability and long-term outcomes. The council is well positioned to convene partners, identify opportunities to align and braid and maximize existing resources. So that's kind of the 3 areas that we've outlined for the priorities related to the action plan. So I'll just stop there and see if there's any questions related to that.
This is Dr. Katrina for the record. So just so the rest of the council knows, I often get, since I'm part of the technical subcommittee, so I get a lot of emails, and then I get emails about these meetings as well. And then so I have a question, and I want to know if the rest of the council members received the memo, because in my email, like I'm often not sure if it's coming, if it's going to the council members or is it going to the members of the technical subcommittee, because I'm on both. So can I get a feel to make sure individuals receive the memo or are receiving the memo and the action plan workbook and things like that?
I can say for me, I have received them. So they are coming to us, and I believe they're probably also posted online. I haven't checked, but maybe Abigail knows whether or not these pieces have been posted online as well as part of the meeting materials. It looks like that is a yes. So
awesome. All right. So I just wanted to kind of make sure that so that we can support them to the best of our ability, that we're making sure that the items that they and we have worked so hard on to get ready for potential votes or conversations and moving things forward are getting to the members timely in order for us to make informed decisions and support and help align and maximize their work. And because they are an extension of a really valuable extension of what we do. And, I trust the individuals in that group to make the decisions about what is needed in our community and where the gaps are. And I just want us to be ready to help and move things forward. So that is why I asked that question. So thank you so much, Brooke, for breaking that down for us.
Chair, Chair, for the record, this is Robert Thompson. I gave that thumbs up that I had received the document. I was not confirming that the document had been put online.
Understood. And Abigail, maybe would you mind letting us know if that has been posted online?
That's in the works, and we will be sharing the link to our public website, so you all would have it.
So much.
So, Dr. Katrina, for the record, again. So, I think so it is the rule that is shared online after individuals are able to vote on it, or and this is shared to everyone via email before that, or would the members only see it after it's online?
There's
And
a,
these particular documents is what I'm asking about.
Sure. So I think on this one in particular, a memo to the council would probably come to the council first, and then as part of these discussions, we can indicate that it should be posted online. Which, I mean, in the era of transparency, I would probably always assume that we would do that, and I think that there's multiple opportunities to do that as well. If that wasn't part of the agenda item, we could definitely even include it as part of public comment. So I'm a very big fan of transparency, and we'll always be willing to post the things online that help us make our decisions and help us move things forward. So, is there any other discussion on the memo? And Brooke, thank you so much for running through it. That's also very helpful. I had read it, but it's good to hear it as well. So,
Yeah.
So this is Administrator Aycroft. Just a quick question, looking at the agenda item, we can vote to adopt this, which, okay, I'm going to assume a motion will be made to that effect. And then there's the second component, which is on how to move forward. Is that something that we should be discussing now, or do we discuss it in agenda item 9 for information only?
that's a good piece. I think if it's discussion on what's included in the memo and the strategic plan, I think we're more than okay to talk about how we can move things forward there, but always willing to put additional stuff on the agenda for future meetings. I do think just looking at how agenda items are structured, we should keep it pretty tight to both the strategic plan and the direction to the council, to the TA on how to move forward. But yeah, I think it's kind of a yes and. I think we can talk about the direction, and I think this item also includes enough language to let the memo be considered in part of that motion that we may see after discussion. But yeah, I think that's my thought process on where we're headed, if that makes sense, Administrator Croft.
I was trying to follow along.
Okay, with circles probably.
So in the reason that I asked that is in the Excel spreadsheet, which hasn't been presented, there's a lot of blank cells, for lack of a better word, in the different strategic issues. And it would be interesting to me if we provided the direction from to the Technical Advisory Committee, if they have some thoughts about who those lead departments are, the collaborating departments, the time frames, the performance measurements. I don't know if that's their charge, but it certainly would be helpful from our standpoint, I think, to at least get their opinions on exactly who they are identifying to take the lead on some of these, and sort of what the anticipated performance measures are.
It makes sense, and I think that we can put that as part of a motion on how to move forward. I think that that makes a lot of sense, and it may also be that on a future agenda item on a future meeting, we have a discussion about what our thoughts may be on some of the blanks from there that we might be able to help with filling in as well. So I think that makes perfect sense.
And then Administrator Raycroft again for the record. Brooke, since you did the presentation on this, I mean, does that seem like something that the Technical Advisory Committee could embrace? Or is that something that you think, you know, to make those sort of recommendations, the draft guidelines for those things in the cells that are missing?
Thank you, through Chair Rob, to Administrator Acroft. I absolutely think that that's the intent of what we're asking through this memo. We believe that there are, we would like to support this council with providing the recommendations of this living, breathing action plan. And, you know, maybe there's presentations that can help inform who can own these different steps in the action plan. Maybe there's work that's already happening at the state level, at the local level, that can help inform this action plan. And the technical assistance working group is really wanting to help move this forward by, you know, kind of providing you all with recommendations of how to strategize these action plans, the action steps in the plan. And we believe because of the leadership at your level, you all have ideally the leadership to sort of help inform and hold account to some of these. Maybe there's areas at the housing division level, or there's areas at workforce development or within child welfare that can really help us advance these particular action plans, and having, you know, you all abreast and aware of these things that are happening, it could help us advance the action plan, I think, a bit more intentionally. So, you know, we would like to sort of be the steward to help you navigate these topics and then provide you with recommendations on, you know, maybe presentations or ways in which we can get it informed.
Okay, thank you. That's Administrator Raycroft. That's extraordinarily helpful. It's an incredibly impressive document. There's a ton of work that went into it. And I think the fact that you guys are still willing to engage and to provide those solutions is absolutely the right path also. So thank you for that clarity.
Yeah, thank you.
Thank you both. Any additional discussion on this agenda item? And
So
I think go ahead.
So this is Dr. Katrina for the record. Okay, so it just for my brain to be clear, so it sounds like we're recommending or asking if the technical subcommittee can assist with filling in some of those blanks. It sounds like Brooke kind of wants some guidance from our group as well, within our leadership levels, to kind of help guide that as well and not put the onus directly back on them, right? So they can, because they did a lot of the heavy lifting, and there may be some levels in state government where individuals on this call may have more pull to see if those entities would be willing to be like supportive of what the efforts are that this group of people did, right? So, you know, when we think about like what is our role moving forward, when I think about that, what does that look like for us? So I think it would be great to at least hear some feedback from other members, not putting anybody on the spot. So I won't have to keep talking, right? But I think, you know, just out of respect, if we could just share our thoughts and our maybe our capacity, and, you know, I'm willing to help on this or that, so that we can both be working, our council as well as the technical subcommittee on these items as a team. That would kind of be amazing, because for me it kind of sounds like it's just it has just been put back on the technical subcommittee and we're just gonna potentially vote. So what does that look like for us to work together on this? And what is our role individually or as a council moving forward to continue to support their work that they're doing for this council? So, yeah, see if any other members have any feedback, questions, concerns, ideas. It'd be great to hear.
Any other members of the council have thoughts that they may want to share?
I do have a
Yes,
question.
come off mute. Go ahead.
Yeah, sorry. I do have a question. I remember vaguely, I don't know which month it was, but we provided, or I provided some recommendations for NDOC's involvement and where I think some of those items we could support. I don't see it on this spreadsheet, but I'm wondering if we just submit some of that again, or I don't know if anyone else submitted.
Absolutely. And I think if there's folks that have previous versions of the document that maybe they might be able to share, I'm happy to receive them, or you can send them to Abigail and we can make sure that they get to Brooke and team to be, considered for updates on future versions of the document. So we keep it alive and keep things moving and progressing, and make sure that our group is also aware of the work that's being done by different agencies. So yeah, more than happy to take additional components to that and work with Paige and team to get the document updated for sure.
I will send that over. Thank you.
Thank you so much.
This is Director Devine. We're working with a lot of the folks that are online today to stand up and do a lot of work with the veterans piece of this issue, with US Vets and all kinds of other organizations. So I'll ask my team to help work with the action team to kind of capture some of the specific things that are happening within veterans to help this project along. So yeah, we'll be providing some additional information.
Awesome. Thank you so much. And then I'll also take for action as well. I'm working with Chris Sewell and his team at Dieter to see what components to the action plan they may be able to make updates or give some context around their efforts as well. If that also sounds like a good idea. Any additional thoughts from members of the council? Okay, hearing and seeing none, is there anybody that would be willing to put together a motion on kind of our path forward for actionizing the strategic plan and keeping things rolling?
I'm trying to hold on.
That's okay. I'll put together what I'm thinking is a
Okay.
possible motion and see if somebody's willing to make a motion to adopt that. So I would say that I would hope for a motion to approve the adoption of the strategic plan and work with the Technical Assistance Committee to continue to flesh out the action plan and get updates from applicable agencies to inform a future version of the action plan to be updated at a future council meeting.
Okay, so Dr. Katrina, for the record, let me see if I'm gonna do this right. So I'm making a motion to approve the strategic plan and continue to work with the technical assistance subcommittee on the action plan by working with community partners, getting updates from agencies, and continuing to move the work forward and getting regular updates. Does that sound okay?
I think so. Do we have a second?
Director Divine, I second. I'm good at that.
Thank you so much, Director. All those in favor of adopting the motion set up by Dr. Katrina Krigsby Tedford?
Aye.
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 Any opposed? Motion passes. Thank you so much, Brooke. Thank you for all the hard work that you continue to do. I'm also grateful to our folks at the Attorney General's office that finally were able to give us a decision that we can and do have the authority to take these steps and work in a way that's collaborative and also, you know, able to inform future strategies that we can pull together. So thank you so much, and keep up the good work, and we'll continue to be in touch on how we can help support all the work that you guys are doing.
Thank you so much, Chair Rob. Appreciate it.
Thank you. Awesome. With that, I think we are good to move into agenda item number 7. This is the Southern Nevada Continuum of Care Homeless Data Update. Do we have somebody from the Southern Nevada COC?
Good afternoon, Brenda Barnes here.
Awesome. Go ahead when you're ready.
Yes, so the Northern Nevada COC and Southern Nevada COC are going to be presenting together, and we will actually start with Northern Nevada. Katrina Peters is on the call, and is Abigail or Gregory going to be sharing our slide deck?
And I believe so. And just so that we keep it clean on the agenda, I'll open up agenda item number 8, and then we'll close that item, move into 7, so that we can take them within a way that I don't think the Attorney General's office would be upset with. So
All right.
we'll start with
we apologize.
No, not a problem at all. That's totally okay with me. Trina, go ahead when you're ready.
Okay, thank you. And apologies, I flip-flopped our slides, so this is on me, and appreciate the flexibility. I'm Katrina Peters. I'm a coordinator with Washoe County Human Services Agency. I also serve as our COC coordinator for the Washoe County or Northern Nevada Continuum of Care. I'm going to share a little bit of information about the COC and our general roles and responsibilities. I'll talk a little bit on some details on how we handle it specifically in Washoe County, and then I'll hand it off to Brenda to share more information about Southern Nevada, because we operate in some similar ways and are beholden to federal requirements. I'm just wanting to not be duplicative in that information. Next slide, please. So often I get asked what the COC is, and I like to start by sharing that it's a group of people working together to solve homelessness in their community. We do that work through shared policy, through shared data, and also by agreeing to certain priorities for the resources that are available. We know that we don't have as much funding as we need to solve homelessness in our community, although we would love that opportunity. So agreeing to those priorities helps us be the most strategic we can be in the resources that we have available. It also helps us to avoid silos. This work involves many different agencies across the community, and it's an amazing opportunity to bring everyone together to make sure that we're all rowing in the same direction, so to speak. Next slide, please. From a technical standpoint, the Continuum of Care is a HUD program, and they define it as a program in their regulations. And in true HUD fashion, they have a very technical definition of what that HUD program is. The National Alliance to End Homelessness also provides a definition to explain what the COC is. And I like to hone folks in on this one because it really includes some key language that I think describes the work that we do very well. They describe the COC as a regional or local planning body that coordinates housing and services funding for homeless families and individuals. And I like to highlight and underscore the word coordinates because it really does take all agencies, nonprofits, local government coming together to be able to solve homelessness in the community. Next slide, please. At the end of the day, the COC assigns some specific responsibilities to an agency that is described as the collaborative applicant. That collaborative applicant receives some funding directly from HUD in a non-competitive fashion. And with that funding, we're required to fulfill 6 main responsibilities. The first is that we complete a consolidated application for funding. Historically, that was annually. In 2024, HUD came out with a 2-year funding cycle that was authorized by Congress. HUD recently put out a NOFO that's subject to a lawsuit. So a little bit of back and forth there, and we'll see how that shakes out. But either way, we're required to put together a funding application at least every 2 years. We're also required to monitor the COC grantees. So HUD provides funding directly to agencies at the local level, but the collaborative applicant is required to conduct some annual monitoring to help ensure clients are working in compliance with the federal regulations. That monitoring also affects each agency's subsequent application scoring during that funding application cycle. So really incentivizing folks in being fully in compliance with those federal regulations. We're also required to manage a coordinated entry system. So this is a no wrong door approach, utilizing a standard assessment that results in a single prioritized list of people experiencing homelessness in the community that housing referrals are made off of once there's a housing funding spot available. We also conduct the point in time count per federal regulations. We're required to conduct a sheltered count, and I'll talk about that in a little more detail each year. An unsheltered count must be conducted at least every other year, and that count has to occur in the last 10 days in January. We're also required to maintain a homeless management information system, so that community-wide database for people experiencing homelessness, so that we've got shared data and information in a shared database for all agencies to be able to put client level data on, and also be able to see where clients may be interacting with different agencies across the community. We're also required to submit some reports annually that are aggregated numbers across the community. Next slide, please. To talk in a little more detail on the consolidated application, there are a couple very important steps in this process. The first is that each agency completes their own program application for funding. Historically, the allowable program types were permanent supportive housing, rapid rehousing, and some smaller supportive services grants to support facilitation of that coordinated entry system. With the notice of funding opportunity that HUD released this past fall, that they rescinded due to the ongoing litigation, that allowed for new program types. So in the future, there may be some different allowances, but historically it was just these 3 program types. Those applications are filled out, and we facilitate a rating and ranking committee. Each application is scored based on the criteria that we have agreed to at the COC governance level. And those applications are also ranked. So this allows kind of a numerical score to be assigned to each project based on some set criteria. The committee also has the latitude to rank applications in a way that reflects the priorities of the community. So if permanent supportive housing was the top priority, but maybe it wasn't the top scoring application, the committee has the latitude to pull that project up and potentially be higher ranked than what its numerical score would indicate. We also complete what's called a COC application. So this is an application that we put together that reflects the work of the entire community. This application impacts our scoring at the national level. So there's some funding that's guaranteed, some that we have to compete with nationally, and that COC application impacts those applications that have to compete nationally for that funding. In FY24 for our COC, we received about 1.3 million. So it is a substantial amount of funding for our community. Clark County gets a more substantial amount, but for our community, this funding is really important and sort of reflects the size of the community as well. Next slide, please. In Washoe County, we utilize a contracted facilitator for rating and ranking because Washoe County is a grantee. There are also some options for funding to be reallocated. That's both voluntary, so an agency can say, hey, we're not going to spend all of our money. We want to put it out for somebody else to be able to take advantage of. There's also involuntary reallocation. The committee could decide, hey, this application doesn't meet our priorities and assign that to a different agency. Both of those are allowed by HUD. And really, we look to the NOFO to dictate what different funding opportunities might be there and what rules may apply to different reallocation limitations. The timelines vary, and those are dictated in that notice of funding opportunity, but we're required to have at least 60 days to put that application together. That puts us in a really tight timeline. So for folks who may have participated in those rating and ranking committees, you'll appreciate how challenging it is to get all this information put together and go through all the required steps in the minimum 60 days. I wanted to talk just a little bit about Tier 1 and Tier 2 because this was a very much a hot button issue with the NOFO that HUD released and ultimately rescinded this fall. Each year, they break down the funding available into two different categories, Tier 1 and Tier 2. Tier 1 is generally understood as guaranteed to be funded, and historically about 90% of our annual funding amount was allocated to Tier 1. Tier 2 has to go out and you compete nationally. Your COC score, in addition to your project score, are factored into who is funded in that Tier 2 competition process. In the NOFO that HUD released in the fall, instead of 90%, they brought that all the way down to only 30% in Tier 1. Here locally in Washoe County, that would have resulted in $1.8 million being reduced from what we would normally consider guaranteed to what we would have to compete nationally on. So that put our funding in a very precarious position and was very alarming and something that we're still very concerned about. Ultimately, we'll see what comes out in what happens with the current pending lawsuit. But if that had come to bear, it would have been $1.8 million locally and about 88 households that would no longer have that funding resource and that housing assistance. So a very drastic cut for our community. Next slide, please. To touch just briefly on monitoring, while we monitor each grantee annually, HUD also comes out and monitors grantees once every 5 years. That audit could result in financial impacts for the agency. So we use this annual monitoring as an opportunity to really provide that training and technical assistance. These grants are very challenging to implement. Tremendous amount of regulations that apply, very challenging calculations on how much rental assistance to provide. So really trying to train folks up to make sure we were setting people up for success if and when they're subject to a HUD audit. Next slide, please. To touch on our point in time count briefly, as I mentioned, it's required by HUD for a sheltered count to be conducted each year. Unsheltered count is at least every other year. Must be the last 10 days in January, and that applies nationally so that everybody's conducting a point in time count at the same time. Ultimately, when we gather that data, we submit that to HUD. We also release that in the community, and generally it generates quite a bit of media coverage. This is also the data that HUD uses when they come out and say, here's the number of people experiencing homelessness nationwide. It's data from each community's point in time count rolled up into that national number. To talk a little bit about our approach in Washoe County, in 2021, we did an observation-only count due to COVID-19. In 2022, 23, and 24, we did our standard methodology. So doing a sheltered count where we pull data out of HMIS, also doing an unsheltered count where we go out and count people in person on a specific day, specific morning, starting at 4 a.m. In 2025, we just did a sheltered count. So we don't have an unsheltered number. This year in 2026, we went back to our standard methodology and did both a sheltered and unsheltered count. Next slide, please. We often get asked sort of what is the purpose of the point in time count, and it does serve some really critical functions. It allows us to gather data and compare ourselves to other communities of similar size, also compare ourselves to national trends. It helps our community better understand what resources we need, especially with that unsheltered number, while we have other ways of pulling people who are maybe participating in a street outreach program. That in-person count of unsheltered is incredibly time consuming, but really is our best opportunity to get a good count of how many people are experiencing unsheltered homelessness. It's also required to stay in compliance with those federal regulations and maintain that federal funding, which is critical. Next slide, please. As I mentioned, the PIT count is really broken out into two distinct categories. The first is our sheltered count. We pull that data directly from HMIS. This includes anybody who's in an emergency shelter or a transitional housing program. It also would include safe havens. We don't currently have any safe haven programs in Washoe County, but that is included in that sheltered count if they did exist. The unsheltered portion is folks who are living in a car, living in a park, living in an abandoned building, really any place that is not intended for human habitation. And this is an in-person count. So we're amassing volunteers, we've got specific map zone assignments, and then we're deploying people at a certain point in time in the day to go out and do that in-person count and ask folks a series of questions who are unsheltered. Historically in our community, we did a motel count. This was not required by HUD. People who are living in a motel paid for with their own funds don't meet the HUD criteria for homelessness. We have subsequently stopped doing that motel count. We just didn't have good enough participation, but you'll see it on some of our documents. And so we like to make sure folks understand kind of why we did that and why we're no longer including that number in our materials. Next slide, please. This is the standard data we put out each year to try to keep some standard year-over-year metrics. So you'll see for years that we did an unsheltered count, we've included that data and those demographics. Then we also break down number of people who are in emergency shelter or transitional housing setting. We also include that utilization data on this document as well. The point in time count is not only a great opportunity to count how many people are experiencing homelessness, but it also gives us a standard point in time to look at our utilization number and dig into some of those trends and make sure that we're aligning those resources with the housing types that are most utilized. Next slide, please. So here are some of our year-over-year data. You'll see between 2021 and 2022, we had a substantial decrease in our unsheltered count. In between those two counts, we were able to build and bring online our Nevada Cares campus. So we added a tremendous number of emergency shelter beds, and you can see that reflected in our numbers in drastically reducing that unsheltered count. In subsequent years, 2023 and 2024, a very similar number of unsheltered. And we will be releasing an unsheltered number for our 2026 data as well to be able to examine those trends. Next slide, please. Here we have our utilization data, and what we really like to message out as strongly as possible are the program types that have our highest utilization, and that's permanent supportive housing. This is a really important piece of data because it tells us that's really where the need is currently in our community. When we look at emergency shelters, we also see very high utilization, but ultimately we want to transition folks to that permanent housing, to those long-term housing solutions. When we look at our transitional housing program type, that's where we see the lowest utilization, and that trend has consistently held true year over year. So when we're looking at bringing new program types online, we really want to encourage folks to look at those programs that have high utilization to be best meeting that need. Next slide, please. To talk a little bit about HMIS, this is our database that we use across the community where we're pulling this housing utilization data and sheltered bed data. We statewide have a statewide instance, which is great. We're all putting data into the same database. BitFocus is our statewide vendor. We're able to take advantage of Clark County's master contract, which we're very appreciative of. That definitely works to the benefit of the entire state. BitFocus is a fantastic partner in this work. And here at the local level, we've really continued to focus on making sure that every agency who's serving people experiencing homelessness is entering data directly into HMIS. In 2023, we were able to get the percentage of providers who are putting data directly into HMIS from 40%, which is where we were in 2021, up to 90%. We've maintained that 90% coverage rate since 2003, which is very exciting. This allows us to pull that really rich aggregate data so we can see those community-wide trends. We use this data to post our monthly actively homeless number that we post on our website so that we can see that month-over-month data as well. Next slide, please. To talk just briefly about our local structure, we've got a leadership council. This operates per approved bylaws. We have a specific governance structure and a formal membership roster, kind of following Robert's Rules of Order. In this group, we tend to focus most of our time around policy and drafting whatever policy needs there are for the community. We also have a regional alliance to end homelessness. This is our stakeholder group. This operates under a come one, come all model. This is where we share new information on new policy, new programs, any general updates. We really encourage any new staff working in the field to come to this monthly meeting so that they can get plugged into this network and also be sure to receive all those updates on any new resources that are coming online. And I've also shared our website where we've got all of our policy documents. So if anybody wanted to dig into those details, that would be the best place to start. And I think that wraps it up for me, and I'm going to hand it off to Brenda.
Thank you so much, Christine. Before we move into the Southern Nevada piece, does anybody on the council have any questions for Christina, the Northern Nevada COC? Okay, hearing and seeing nobody come off mute, I think we're good to move into Southern Nevada. Go ahead, Brenda.
Thank you. I believe the next slide is also their COC's website. So just want to pause for people to have a moment, but I know you'll be getting these. So thank you. Yeah, you can jump into the next slide. Just my introduction slide. Good afternoon. My name is Brenda Barnes. I'm the Southern Nevada Homelessness Continuum of Care Director and with Clark County Social Services. Next slide, please. So I'm going to fly through some of these first slides only because just mirror images of Katrina's, but maybe just shared a few things kind of to supplement that. And this is our COC's mission and vision statement. You know, we do want to promote a community-wide commitment to ending homelessness and where everyone is feeling safe, has access, and is dignified. Next slide, please. This slide and the following slide, if you want to just go ahead and jump to it, are our guiding principles. I'll let you read those on your own. Next slide. And just kind of want to share a little bit of a visual of our COC board composition. We have the board voting members. So altogether we have 15, but 18 if you count our ex officio that kind of fit the lead positions that Katrina had mentioned earlier, a cloud of applicant, HMIS lead, and coordinated entry lead. Our community does not have a coordinated entry lead entity, but the cloud of applicant and HMIS lead help to support that role to ensure our coordinated entry system is constantly improving. Our charter has included having board members of lived expertise. That includes 3, with 1 youth advisory board member in addition to that. And so we have 8 elected representatives that are community-based, and then 4 from our jurisdictional partners that contribute to the funding towards the COC. Next slide, please. These are our 4, excuse me, we didn't update it. It's only 4, not 5 government agencies that contribute to our consolidated plan. Clark County, North Las Vegas, City of Las Vegas, and City of Henderson. Next slide, please. We always like to highlight the funders that contribute to the COC. So as Katrina mentioned, the cloud of applicant is responsible for the notice of funding and responding to the funding opportunity. So to dive into this a little bit, next slide, please. Our funding priorities here in Southern Nevada do focus around permanent housing and permanent supportive housing. With the most recent NOFO that we've responded to, the 2025-2026, our board did vote to prioritize our permanent supportive housing before rapid rehousing, really ensuring, to Katrina's point, of like the most vulnerable, the people that need it the most are filling that permanent supportive housing capacity that we already have. And just knowing that we're going to lose some potentially, we prioritize that within our local competition. The application process, as she mentioned, involves a scoring and ranking team so that our providers locally have to submit a competitive application. We did have some delayed funding projections. We had some programs that ended in the first quarter of this year. Fortunately, we've been able to start receiving some of those awards, just given all of the complications that we've been seeing from the administration at this time. we do want to highlight that those projects that are applying to our local competition have to meet thresholds. That includes how we've scored or determined scoring on how they can handle managing federal funding dollars, so their financial oversight and their capacity to do that, as well as performance data to keep the scoring objective. Next slide, please. In regards to monitoring, we have generally hired or contracted with a third party to provide more monitoring for the Southern Nevada COC. This year, we're working with the monitoring team to also train and elevate the COC support team so that hopefully we can open up those funding in other directions to support some of the other groups that we fund through the planning grant dollars. So I just kind of wanted to highlight that just in a slight different nuance from our Northern Nevada partners. Next slide, please. So I really wanted to focus more on some of the reporting that we've recently submitted to HUD. So as of today, we are still waiting to hear responses on our system performance measures that we've submitted. We submitted on March 4th, and then HUD likes to sometimes question or ask clarifying details, or we've determined we may have to make some additional data cleanup. We do want to highlight, I want to highlight really quickly before we dive in regards to that system performance measure data cleanup, we had over 2,000 data elements that our street outreach teams collectively from those 4 jurisdictions I highlighted earlier come together and review, just in making sure that our data reported to HUD was as accurate, clean, and just like on the mark as possible. So it was a huge like lift locally as it is for everyone, but also we saw huge amounts of successful exits just directly from our street outreach efforts. So that could mean from unsheltered homeless straight into a shelter, transitional housing, rapid housing, or permanent supportive housing program in our community. And the increase went from 23.5% in 2024 to 34.36% in 2025. And so we've already kind of seen it, and we can't give you a measurable increase yet just because we want those final numbers from HUD. Next slide, please. Although this isn't LSA or system performance data, the AHAR that we have, it really highlights kind of what things have been looking like locally. And this is a 10-year trend. And although it's all of the reporting that we have together, it does not include the housed at the time of the hick and pit. So I just kind of want to highlight the AHAR report in that nature. When you see all of our reports together and how they've kind of been moving along over the years, generally our pit data seems to be a little bit more flat there at the bottom in the dark blue, with some ebbs and flows, but pretty consistent. But the LSA data, the households, people that, all year, there's been a huge growth. Significantly after COVID, right, in 2020. This household size is also increasing from 1.19 to 1.31. And so kind of just highlighting with you is that as households are growing, it's also harder to place them together. Families are larger than they used to be. And without affordable housing and housing units available to them, it does make things a little bit more challenging for the boots on the ground working with the community. But yes, housing numbers do grow, but around 2022, after the spike from COVID, is when we really saw that hit home a little bit for us. Next slide, please. A little bit on our point in time, Katrina did a phenomenal job. Like, we kind of follow in suit. I think we kind of execute, our pits very, very similarly. So I don't want to kind of dive into that, but, just highlighting it is a single day. It's a snapshot. And she shared that with you. This doesn't speak to what it looks like all year long, but, it's still valuable information. And, lucky for us, HUD does require it. So we share that out and then utilize pretty much the outreach data for more of the drilled down demographic and methodology when we respond to HUD. Next slide, please. Our housing inventory count, again, done the same night as the pit. and just kind of showing some of the trends and what that looks like. We have seen growth over time, true growth coming after 2022, you know, heartaches from COVID. But locally here in Southern Nevada, we really were able to expand some of our shelter capacity. We had a lot of non-congregate shelters come on board, 2 of which were specific to families. So we saw a huge spike in families experiencing homelessness only because they met the definition of homelessness. And the caveat to that is we were able to kind of loosen the burden of our child welfare system by reunifying kiddos that are in foster care with their families who otherwise weren't eligible to reunify because they were couch surfing or in places that didn't want to be involved with child welfare system. They weren't literally homeless. They weren't captured in our homeless system because of their resourceful nature. So by finding a location to keep those families together or reunify those families, it did increase numbers in our homeless system, but it did kind of create better outcomes on our child welfare side and with putting families together. Next slide, please. And our longitudinal system analysis report, kind of just showing unduplicated counts of individuals and households over a time period. If there were multiple episodes, entering shelter, exiting, reentry, it is only counted once. And we have seen a growth of individuals per household through this report. In 2018 to 2019, it's about 1.19. In 2022, it was around 1.23. And then in 2025, 1.31. So a little bit of a breakdown of how the household size is increasing. And keep in mind, households doesn't necessarily mean a family. It could just be 2 adults, you know, 2 individuals living together or with the intention of staying intact together. Well, we did share this with our COC membership, and they kind of wanted to just highlight how it is harder to house families. In the LSA data here for 2025, it actually reflects that families had less days homeless, 94, than adult-only households, which experienced 107 days homeless. And to exit to a permanent destination at higher rates, 40%, than our adults only at 15%. Families have higher rates of entering directly into rapid rehousing at 18% than an adult-only household, which is only at 4%. Adult-only households have higher rates directly to transitional housing, which is 11% versus families to 1%. So our families are able to utilize the permanent supportive housing and shelters and rapid rehousing versus transitional housing. And so kind of wanted to highlight that there a little bit. Next slide, please. And not to get into so much of the data of our point in time count, but just to elevate, we have an amazing relationship with our northern counterparts and our rurals, just in the sense that we collectively agree upon or try to identify and come to an agreement on the day that we conduct our point in time count. And so with that, kind of wanted to highlight that we both skipped last year. As blood, sweat, and tears that we received for that, it really positioned us to kind of reset and move forward in a meaningful way that was aligned with HUD, but made sense to our community. Dr. Katrina Grigsby is part of those efforts, and we appreciate her input and guidance as we navigated a new approach this year, looking forward to the years to come to be doing it the same way. And so kind of wanted to highlight more of what that looks like for you on a executional level. Next slide, please. It took about 10 hours and 20 minutes for all census tracts that we conducted pits within for our COC and our volunteers. This was the above ground count only. And then of course, the tunnels took a little bit longer, and really appreciate the outreach teams that primarily focused on the tunnels, while the community volunteers and working groups and all the efforts of everyone else kind of throughout the day. As you can see, we started at 3 a.m. With the city of Las Vegas, and that was focused on our courtyard and our corridor of hope, and then kind of expanded from there. So again, just kind of a little visual of the manpower in the day of what it really takes to complete our point in time count here in Southern Nevada. Next slide, please. So we did have over 526 staff and volunteers that supported every deployment site throughout the Valley. We completed 2,003 surveys. We highlighted this because the previous year, I think we only reached about 1,500 surveys. So that's how many people we were able to engage on the day of the pit, and kind of takes the most time, right? As we ask them the various questions. Some are required by HUD, and then we have a few more that just are really specific to our community. So a total of 2,021 surveys when you include Mesquite and Laughlin as well. And that's kind of a quick visual. The next thing I wanted to point is everybody wants to know when they're going to get our pit data. When can we share the numbers and what's happening next? And it takes time. Not only do we have to complete the physical pit count, which we have done, and yes, it's already March, but the location data has to be cleaned up. Survey data is downloaded from the app. It's checked for location issues. You'd be surprised, but somehow it might be in California. And so all of those things have to be cleaned up and made sure that we're not like duplicating counts and things like that. Some surveys were performed outside of the COC, where they were unable to get geolocated or canceled. And so for those things, those are all things that they're working on to clean up. Once the location issues are resolved, the tunnel count and the main count are compared, again, to make sure that we aren't duplicating any individuals, but between the tunnel and our regular teams. And then we review the interviews from the main survey, and they're compared by initials, date of birth, information that further minimizes duplication. Then we start reviewing the demographic data. And with the knowledge that the response rates are never 100%, HUD publishes their own tools, right, for demographic extrapolation. It does require an 80% response rate of surveys. So although we had more surveys than we've had before, compared to the total count numbers, we didn't hit 80% of those experiencing homelessness to utilize the survey data. And that's where we start utilizing our annual outreach data that we collect throughout the year to pull from for what we submit to HUD. And then there's a final review and submission. Once the deduplication is complete, our demographic profile is applied, the report's ready for review. A good method to check the reports, either to enter it into the HUD submission portal, where it flags all of our possible, data entry errors or quality issues, or kind of just like working on it locally. Ultimately, we use that process. We do as much as we can, ensure it's as clean, as accurate as possible. HUD always responds with a, hey, what about this? Why is this so much different than the previous pit count that you conducted? And then once HUD has issued their final approval, hey, everything's complete, this is what we're accepting, that's what they then enter into their system and feeds into the AHAR, we're able to release it to the community. And so that is why there's such a long delay, and why we get hounded so frequently on where's the pit data and when can we use it. And so since I had you all here, wanted to share that because I'm sure you're interested to see those numbers as well and how they compare to our previous years. Next slide, please. So this is me wrapping up. Always like to provide resources and areas that you can redirect folks to online. Clark County's resources. Help Hope Home is the Southern Nevada Homelessness Continuum of Care site. We have a live resource dashboard. Depending on your location, you can look up a certain topic and it'll let you know what's near you for those that don't have access to transportation that you might be trying to assist. And then, of course, as always, Nevada 211. Next slide, please. Just my information, and we appreciate having the time to report out together. Thank you.
Thank you so much, Brenda. Any questions or comments from members of the council for the Southern Nevada Continuum of Care? Okay, hearing and seeing none, thank you so much. Thank you both so much for all the work you do and bringing that information to us. We look forward to seeing the point in time counts come out when those are published. And if you guys see need, we're happy to have you back to discuss those numbers as well, and any progress or challenges that we may be able to bring to this team to help work through. So thank you so much, and thanks for all that you do. So with that, I think we're good to move into agenda item number 9, discussion of agenda items for the next meeting, which is going to be May 21st of 2026. I believe at 1 o'clock again. Abigail, correct me if I'm wrong, but I think that is the time that we've decided on. And I think that we'll start with an update for the TA on any additional changes to the action plan and any additional engagement that members of the council have been able to find and help address and keep that action plan and strategic plan alive and well and keep things moving in the right direction. And then I think our other one that we typically have is the housing division update. I think that one might be in statute as well. So that is a required component to our meeting. So any additional items that members of the council would like to see on upcoming meetings? And feel free to reach out to Abigail, myself, on any items that maybe come up in the time between now and when we have to publish the next meeting. Colonel Devine, go ahead.
Would we have the opportunity to add to the agenda maybe the results of some of the grants that we've talked about, like who were the awardees of the grants? I think that might be helpful to our different organizations so that we can amplify the message of who got the grant and what's available and out there.
Sure. And are you talking for your department specifically or additional departments or the COCs?
In general,
all of it?
the
Okay.
COC in general.
Awesome. Yeah, I think financial updates are probably something we should definitely be looking at, especially as we build budgets towards the 2027 legislative session and things like that. Probably great context for sure.
Thank you.
Let's brainstorm maybe offline who might be best to bring that to the team. Cool. Thank you. Any additional thoughts for future agenda items? Okay. Like I said before, feel free to reach out if anything comes up in the time between now and the next meeting. With that, we'll close out agenda item number 9 and open number 10. This is general public comment. No action may be taken upon a matter raised under this item until it has specifically been added to an agenda. Comments may be limited to 3 minutes. If you are making public comment via phone, please call 1-775-321-6111. Meeting ID is 974-857-615 followed by pound. We are now open for public comment. Does anybody on Teams wish to make public comment? Okay, hearing and seeing no one come off of mute, I will take a quick liberty to just thank the staff that put all this together, all of our presenters, and all of you that have shown up to this meeting. I'm really thankful every time we get to meet quorum. I'm pretty bummed when we don't. So there's a lot of work that goes into all of the things that each one of you bring to the table. So thank you. Thanks for being here. And I look forward to meeting quorum on May 11th or May 21st. So please keep that on your calendar and we will see you guys then. I will open it back up for anybody that maybe has joined us for public comment. Okay, I think with that, we are good to move into agenda item number 11, which is adjournment. I don't know that we need to make a motion or have a vote. So I think this meeting is good to conclude at 2:20 on 3/19/2026. Thank you all for being here and we'll see you on May 21st.
Thank you.
Thank you.